We have mini tummy tuck, then we have the classical tummy tuck. The most popular procedure that we are doing in our clinic is...
Which one's for you? Keep watching to find out.
We are doing basically 5 types of tummy tucks. Yeah, so we have mini tummy tuck, which is small incision. We are not changing the belly button position. Basically, we are removing only the lower part of the tummy. We are not correcting the muscle. If we have muscle separation, it's not corrected. Then we have the classical tummy tuck, which we all know very good when we have incision from hip bone to hip bone. When we are opening and dissecting all the tummy up to the xiphoid bone, chest bone, we are correcting the diastasis if necessary, or fixing the tummy muscle laxity. We are making a new opening for the belly button, and that's the classical tummy tuck. The most popular procedure that we are doing in our clinic is extended tummy tuck. It's longer incision that goes all the way to the back, but not connecting. So we are addressing frontal area of the tummy, which is usually very loose. We are changing the flanks, which again, patients after massive weight loss, they have problem not only in the frontal area, but also in the flanks. So extended tummy tuck helps to correct both frontal view and side view. During this procedure, so we have the regular tummy tuck with all the dissection, with up to the xiphoid bone, muscle repair, plus we turning the patient on their tummy, and we starting the surgery from the back. We are removing the flanks, the lax skin, fat, other tissues, then we're turning around and doing the final tummy tuck. And of course we have 360 tummy tuck. Basically 360 tummy tuck, what we are doing, we are dividing depending on the patient's needs. This can be lower body lift when we are doing thigh lift and buttock lift on the same procedure, and removing excess skin and fat, or it can be belt lipectomy, especially for patients who lost 50-60 kgs of weight. So they have laxity all around the body, and we are addressing everything. We are starting from the back and then turning the patient around on their back and doing the tummy. Doing tummy tucks, we are almost, I would say, 80% of times we are combining with liposuction, because it helps to achieve better results when we are combining with liposuction tummy tuck. After the tummy tucks, patients are staying for 2 nights in our clinic, in the department. Always checking patient's body mass index, that's the most important thing. Then we are checking patient's age and other diseases. And very important, if patient is a smoker or not. Yeah, these are 4 main things. If we have older patient, high BMI, let's say more than 30, smoker with diabetes, any kind of surgery won't be offered for patient. Whether it's extended, so if it's extended tummy tuck with liposuction, we start from the back, then we turn on and doing that, it's around 3 hours. If it's only the tummy tuck, classical tummy tuck, it's around 2 hours. I would say it's our workhorse in our clinic. It's the most popular procedure in our clinic. Like, I can't even tell how many, because we are a clinic that are doing big surgeries, combinational surgeries. Patients are coming here for really big procedures, like 360 tummy tuck with breast lift, liposuction. It's very long, very big procedures, and we are doing cases like in general complications, infections, bleeding after the surgery. These are common, but actually we have very little complications regarding the tummy tucks.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.